we'll go ahead and just have you chat in your name and your institution, and there will be time at the end and for different points at times for us to go ahead and open up the line for questions and thoughts. So this is our agenda for today. Elsa, are we ready to get jamming? Okay, so we'll go ahead and start with our presentation. So just as a quick overview, we were almost able to meet our overall goal for the year, even with bumps in the road, also known as coronavirus or COVID-19, which ended up putting a halt to the procedures. And throughout our state, basically starting in March, we are still probably well over 90% of our goal. And I think that's a huge testament to all of the need and all of the great work. So round of applause for all of us still almost meeting our goal, even having to shut down screening about 3-4 months early. So we'll go ahead and have Elsa, do you want to go ahead and share a little bit of the breakdown in numbers here? And thanks for the yay in the chat. So woohoo! Do you want to share a little bit about the numbers overall?
Sure. And so these numbers are not the final numbers for the year in terms of screening, because we still do have the June data, the final June data coming in. But in addition to almost hitting our goal for CRC, I would say we exceeded our goal for the number of patients that completed the family history screening tool, even with having to halt for COVID-19. With Denver Health and Uncompahgre Medical Center out in Norwood as our two partners for that. And so we're also have continued with our pilots in lung cancer screening, and Bruno Caritas was able to get 27 patients in for shared decision making, and then 12 of those patients screened for lung cancer to date. Now lung cancer screening starting back up again at NJH, and we were also so close to getting started with that process at Summit Community Care Clinic, so hoping to continue that in FY21. And then we did have 11 new clinics start the sustainability planning process and complete that assessment with their team. And we did reach our goal of 10 clinics developing a sustainability goal and plan. So we're right on target with that. And we will be having the rest of the clinics complete that next year if you haven't already. And one last great accomplishment to share. We had 23 navigators take and pass the Colorado Health Navigation Registry assessment in this last year, and so we now have 37 total CCSP navigators on the registry. We are so appreciative of all of the time and effort you all took in preparing for and completing that exam, and we're really excited for the opportunities that will come along with that into the next year. So thank you all for making all of these accomplishments happen and really doing the work behind the numbers.
Awesome. And I just want to say that Colorado, again, remains a leader in this area. And I think as we're expanding to risk stratification around family history, the lung work, that we really remain on the cutting edge of looking at population-based approaches for the medically underserved to provide resources. And this is all of you. This is all of the work that's happening in the field. So this is 2,000 people who were screened for colorectal cancer who weren't a year ago, and we prevented disease, found and detected things early to help people have better lives, and really even with the family history and the lung work, making huge impact. So I love the yippies, the yays, because that's exactly where we're at. So huge thank you, and a huge thank you to Lori and Elsa, who have put in tons of the effort and muscle for keeping this program afloat and doing a lot of the great programming. And we're a small but mighty team, but all of you in the field, hundreds working to make this happen, and we couldn't do it without you. So yippee. And then Elsa, in terms of the navigation registry, with the exception of folks who are new, we've met our full-on requirement for making sure that clinic systems have people on the registry. Is that correct?
That's correct. So with the exception of about 2 clinics that had some changes in staffing and are in the process of getting on the registry, we have at least 1 navigator on the registry from every formally participating clinic in CCSP. And so, yep, we met our goal right on time, and the health department will be very happy to hear about that. But again, as Andy said, we're on the forefront of this work, so more still to come with it, and we really appreciate you helping us meet that goal.
Awesome. For those of you just joining, I think there's a couple key in your name, what institution you're from. The big news is we almost nearly met our goal with having to cease screening early because of COVID-19. Made some huge ground this year, and really, even with a truncated year, we pretty much are straight on point. And again, huge kudos to all of you. So speaking into moving forward, Elsa's going to advance. We did want to hear from all of you about how the COVID-19 preventive screening elective procedure ban is basically impacting you. And I'll have Elsa run through the statistic right now. And we are going to be hosting a survey as well, Elsa, right, in the next couple of weeks, where we're also going to gather some information. You know, I think just truthfully, I think we have a period of time where the elective procedure ban is reduced. We are ready to start screening again. There's been a lot of attention on the national level about the impact of screening and ultimately pent-up demand, what we're going to need in terms of resources to move this going forward. But I think we also have the reality that the elective procedure ban may happen again. But if we are, I think, are really thinking critically about when we do and don't stop screening and for certain populations, that's something that will probably be taken into effect. If I had a crystal ball, I think that if we hit a huge surge where there's another ban coming, there might be some stratification based on risk factor and a few other things, and it might not be as harsh because ultimately delaying screening as opposed to going out for that and risk. I think they're really trying to balance disruptions in care and screening as opposed to really thinking about people being at risk for the actual virus. So I think we'll see some updated guidelines if we would see a surge at some point, but we do know this has made an impact, and it's something that will be in our future moving ahead. We will be having a survey where we're asking overall this year, how did we do as a program? How did we support you? Where are you in terms of your uptake of getting screening up and going again? What were factors that are barriers that the program could help with at this point? And then ultimately, what was your experience? But Elsa, do you want to talk a little bit about this graphic and then ultimately some of the questions we'd like to hear, maybe even real time today in response?
Sure. So this graphic was published by the National Colorectal Cancer Roundtable just recently. I've linked their playbook for reigniting colorectal cancer screening in response to the COVID-19 pandemic. But this was from that. And they talked a little bit about estimates of how many patients might have missed screening or had delayed diagnoses of CRC just in the small period from early March through mid-April and then beyond as screenings were starting to get started again. So this shows that nationwide, at least 1.7 million patients missed colonoscopies, and these delays in colonoscopies and diagnoses could result in late stage diagnoses once those patients get a colonoscopy, and maybe an increase in mortality as well that we'll see play out over the next decade. And so we know that this has been really hard on all of our clinics and our patients, but Colorado is not alone in experiencing these difficulties from COVID-19. And so even though declines in health visits were very widespread across the country, there has been a lot of work in trying to get virtual visits up and going again, and then make puts procedures in place in order to get screening going again. And so even though that there's been so much work in this area, there's been a lot of barriers for everyone nationwide. 80% of primary care providers reported in this survey that their patients are struggling with virtual care. There's still that recovering from the 63% decline in health center visits, but that's on the upslope from April. And so we'll still more to come from the impact of that. But we appreciate all the work that you did during this time, and that we know that this is going to be a continued struggle, but also lots of innovative work happening as COVID-19 continues to play out. So just wanted to put this out there as food for thought as the national data, get you thinking a little bit about how your own health system might compare.
And again, we will be capturing some more information from all of you in the survey. And if you have anything that you want to type right now about any of the feelings, thoughts you're having about this, any ideas about what we should be considering, we are really here for you as a technical assistance team in terms of implementation of this work. So this is, your input is much appreciated. And I do want to also say that we will be working with our Cancer Coalition team around a best practices and kind of a sharing of examples of lung cancer screening and colon screening. And Elsa will talk about that shortly too, a little bit about those opportunities. But we will be having a workshop coming ahead featuring a couple different clinic systems to talk about what they're up against. What are the factors that folks are considering for really getting preventive screening up and moving again? But it will be used as a workshop for all of us to really do some additional brainstorming and have some dedicated time. Today is really about the updates and what's going on, but this workshop skill session is moving ahead.
And I do have the info about the workshop at the end, so I will share that with everyone.
Elsa will share a bit more about that, but we'll be digging in. All right, so here is the good news for all of those of you who've been on the roller coaster with us with the CCPD funding, which is all of you who've written letters of support, shared your support of CCSP with speaking to leaders or testimonials. A huge thank you, it makes a difference. I can't say enough about the strong will we have to keep the preventive screening services in the state supported. But here's where we landed. I think last time we chatted, the state was still deciding what kind of cuts would be happening to programs through the Amendment $35 in our grant funding if the state of fiscal emergency was declared. At that time, it was thought that CCSP might get at least a 50% cut, a 30% cut. We were spending a lot of time sharing the impact. One of the big things we were talking about is, of course, as a direct screening service and navigating people who have barriers to care, especially COVID-19 hit them. The patient population we're serving dramatically hard, and the preventive screening services. And so we really needed to advocate for better navigation into preventive care. I do think that the review committee heard it. There were a lot of great comments. In the 3 minutes I had to talk, I turned this chair into a throne of toilet paper to make a point and to be memorable to the committee around this work. And ultimately, Elsa, can you hear me okay? Oh, sorry, you froze for just a sec. So ultimately, I think that the review committee understood, they do understand what we're up against. I think there's a lot of proponents for CCSP, but what ultimately ended up happening is in the 11th hour, the Colorado legislature did not have a 2/3 majority to declare a state of fiscal emergency, and that would have been the only way that our CCPD Amendment 35 funds could have actually been rated of some level, because it's a constitutional amendment, and the only way that they would be able to get a hold of those funds is if the entire legislature, a 2/3 majority, said yes, those funds would be on the table. Our overall legislature did not pass that. So at this time, the CCPD and our CCSP funds are not vulnerable for part of the reduction to help balance the state budget. So we will maintain our current budget of about $750,000 per year, including the previous cut. The only thing I would say is that we do know, though, that tobacco revenue was down this last year. They haven't made any proposed cuts at this time. They've told us to move forward as our original budget is stated, with our original trajectory for screening allocations, navigation allocation. So we are going to continue as is. What I would say to all of you is, coming off COVID, knowing that this money, is on the table here, but if a state fiscal of emergency is declared early next fiscal session, that would happen in January or February. Now is the time to get patients in to be screened as much as you can, to provide opportunity for people to schedule, to get everything in order, so that this fall, that we can do as much this summer and fall as possible. That's going to be the name of the game. So in short, the grant is secure for now. These proposed budget cuts have not come into effect. The revenue will be coming in December and September. That's when those cuts might happen. And then the new legislative session will start in January or February. And that's where we might have the discussion of a state fiscal emergency again. So basically, now is the time. So please, as much as you can, talk to your GI centers, talk to your medical champions, talk to your patients, as much as you can, get the wheel going for any type of preventive screening, even if it's FIT and FOBT programming, whatever it might be, knowing that colonoscopy is a follow-up. Try to do that as quickly as you can to get that moving, so that we can use this period of time where CCSP has the money, where we're looking at a release of the elective procedure ban. As much as we can hustle right now is imperative. There was discussion of giving us another year of funding and an extension for another year. At this time, that discussion is being tabled. So good news, we have the funding, we're not being cut right now. Bad news, there is a revenue forecast coming that shows less money, which we could get a bit of a decrease. And there is a potential, when the legislature starts again after this winter, that we might see further decreases. Good news, good news, good news. Focus on positive. Let's get people screened. Let's use those resources while we have them. If we screen our total number even by Christmas time, good on us, we'll have met our goal. We'll have used the money. There's really no penalization for basically getting done early. So let's use the resources while we have them. So I'm going to stop there and see in the chat if there's any questions, and ask Lori and Elsa if there's anything else about the state of our funding currently coming in this next year that you wish to share. Are we good?
Yeah, I think you covered it all, Andy.
All righty, and there's Lori from the Grand Canyon. So
that's the Superstition Mountains in Arizona.
Oh, I'm sorry, from the Superstition. Okay, very good. So we'll move straight on then. So wrapping up fiscal year 20 and 21, I'll have Lori jump in to talk a little bit about where we are with our deadlines, and Elsa to talk a little bit about our reporting, and moving on to the next year, ladies. So Lori, I'll pass it to you.
Okay, thanks. I've already started to receive some of your June invoices, so that's great. And just a reminder, next Tuesday, July 14th is the deadline. So you need to have all your invoices into me on that day. If you have an issue with that, please let me know and we can work on it. But I only have that week to input all the payments because of the grant deadline. So if you can possibly get it all in by the 14th, that would be great.
Great, thank you, Lori. And from the evaluation side, we need your final evaluation report. If you had any additional patients screened in June that you have not yet reported, that needs to get into Qualtrics by July 10th. We need it a little bit earlier than the billing deadline because our final report to the health department is due on July 15th. So I need just a few days to pull together the final data. So thank you to everyone who's already submitted your initial June data. Really appreciate it. And then we will have a new link for the evaluation reports for FY21 That has already been set up. It's linked here. I will send it out in our follow-up notes as well. If you're already thinking about your July 20 data. I don't yet have together the final version of the tracking spreadsheet, but we haven't really made any changes to the data. So you can either keep using the one you already have, but I'll send out a new template very shortly as well. And then as Andy mentioned previously, we have put together a short survey about your feedback on the last year of CCSP and looking ahead, some more specifics of what your current status is for screening patients with COVID and training and technical assistance education needs for the next year. So I'll put that in the chat as well. And it's also going to be linked here in the slides and in the follow-up notes as well. So we ask that at least someone from each clinic system please complete that survey so we have an idea of where we're at and how we can be of best support into the next fiscal year. And as Andy just mentioned, we appreciate all your hard work. Now is the time to get patients in for screening. And we know that there are continued challenges, but we're here to support. And then Andy or Lori, do you want to say anything about allocations for this next year?
Andy?
I think at this time we'll be looking at probably similar allocations to last year, in that we haven't had substantial changes in the budget. Perhaps if there is a change in your volume that you think is going to be something that's changed dramatically, let us know. I do think Lupe just sent a note that we understand that people having the pre-COVID testing is a bit of a barrier. We're looking at the different issues around people having barriers to screening and the like, and I know those might impact numbers. We will be working and strategizing with all of you to think about maybe barrier reduction funds to help people with some of the additional steps that will now happen as a result of COVID. Those might impact numbers and the like. We're going to aim again for the same goal, and we're going to aim for clinic systems with folks being, vigilant in terms of, can you use those resources? How do we need to change them up? If you can't reach those those allocated numbers, what are those barriers? What can we try to do to help? And then if there's absolutely no way around it, but we have clinic systems that are going strong that can use them, we will look at reallocation as well. So we will be sending out those projections in the next couple of weeks around what we're thinking around allocations. But I think it's going to be very similar to last year. But I do, again, know, and there's some good fodder in the discussion, is ultimately the testing sites and how do we get people tested ahead of time is something we're going to have to consider and something we're going to have to look into. So when, I think we'll be making some, I think in the survey that's going around, if you can let us know right now, if you have ample ability to have people tested, if the GI centers are doing any testing or recommending sites for patients, like what does it look like to have people tested so that they can have their preventive services? These are the kind of things that we need to know, because then we can try to make some impact with our program and other policymakers to look at this opportunity, or at least get it up as an issue raised so that we can draw more awareness and hopefully provide better access. So Lupe, this is amazing feedback. This is the kind of things that we were going to need to know. And so I know we probably don't have, we can, at the end of the call today, we can have some additional discussion with all of you around this work and what you're hearing, but we'll also take that opportunity in the survey to learn more about that. And then we will try to do startup calls like we have every year with each of the clinic systems to hear a little bit about what's going on for you and how we can best support you as well. So those will be coming between now and August, and we'll be scheduling those coming for. So, so looking at 2 days before, okay, yeah. So definitely looking up some pent up demands and need, and that's probably going to be different throughout the state. So Lupe and others, thank you for sharing that. We are going to follow up with you about the specific needs and see what we can do moving ahead, and actually speaking with our health department as well. So thank you for this information. More to come on the follow-up. Lori, anything else to add about startup for this upcoming year?
Just that I think most people know that I'm retiring next month, and I will be sending out a formal note to everybody regarding where to send their invoices going forward. But just to reiterate, I will be retiring.
Yeah.
Yay!
Uh,
After this is my 13th year with CCSP.
That's incredible. Amazing. So Lori, it's a huge thank you to all of Lori's great work, and we will be, Lori will be helping us transition some new team members to help us. So congratulations, Lori. Carla, don't say that to her. I'm just gonna pretend like it's not happening, but huge thanks to Lori. I agree, Carla, huge congratulations. So we will be transitioning new team members. Take me with you, Lori. Good. So now everybody's leaving the island. That's good to go.
Let's all go camping.
Let's all go camping. So we will be connecting with all of you to talk a little bit about sites, testing sites, how to move through this, moving ahead, dedicated conversations, and then receiving your dedicated allocations moving ahead. Suzanne and a couple other folks had emailed me also about some of your scope of work checks that might have arrived. If you did participate in the family history work, lung cancer work, some of the sustainability work, we would have reached the point of the year where you would have went ahead and met your objectives. And so those scopes of work that were vetted to you, your program teams, your administrative or fiscal teams, those were all agreed upon earlier in the year. Those checks would have come through. So I think I've gotten back in touch with several of you asking what the reimbursement was for. I will follow up if you have additional questions, but I think several have emailed, and I will just make sure and follow up. And I think I got all of you. But if you receive at this point a CCSP check, it would be to help reimburse for any of those areas where you've committed specific dedicated scopes that we were agreed upon earlier in the year. So let Lori or myself know if you have any questions, and a huge thanks again for Elsa and all of the great evaluation work that she's done to help keep our program afloat. Because with the great eval and our fiscal teams moving, we've been very efficient and we've been able to show our impact and progress. So, okay, next slide. I'm going to have Elsa share the rest of our data and evaluation info. I'm going to leave the call because I need to actually facilitate another call today. But I just want to say on behalf of our entire team, those of you who've been working with us for a number of years, as well as those of you who are new to the program, we really are one of the country's largest screening prevention navigation programs. The work you're doing in the field makes really the national headlines. We really talk about what we're doing with our ACS national partners, CDC and NCI, on the regular, and this is because of all the great work you're doing and all the impact we're making in our communities. So thanks a ton, everybody, for all the great work. We will be following up with additional resources, opportunities, screening allocation, emails, as well as startup calls for the rest of the fiscal year. Thank you guys all so much, and I will talk to you later this month and next month for sure.
Thank you, Andy.
Thanks, Andy. Lori, anything else to add before I move on to a snapshot of our last year's data?
I don't think so. I'll probably be signing off too.
Alrighty.
And if I don't talk to everybody, see ya. Thank you for all the support over the years. It's been an awesome program to work on for so many years. I appreciate all your hard work. See you guys.
Thank you, Lori. We appreciate all your work.
Bye.
All right, everyone. So in this second half of our hour today, I really just wanted to share a snapshot of our data from FY20 in the colorectal area, colorectal cancer screening area, and then just a quick snapshot as well of our patient satisfaction survey, and then closing it out with our sustainability planning goals to date and trying to think about continuing that work on to next year. We're so appreciative of all of the time you all take to collect and report back on this data. So really wanted to show some of our accomplishments of the program overall this year. Again, this is not our final data for the year, and I will send that to each of you once we have those final numbers, including a snapshot of your own clinic's data. But overall, just wanted to show where we're at so far with colorectal cancer screening for the last year. So per your Qualtrics reports, you all have navigated at least 2,592 total patients into colonoscopy. So that includes those that are CCSP eligible and the non-CCSP eligible patients that you all are navigating. We all know that you do so much work beyond the scope of just those CCSP eligible patients. And so it really was 2016 CCSP eligible patients that you navigated all the way through into their colonoscopy appointment. And with the addition of collecting information about cancellations this year, in addition to no-shows, we can show that our no-show rate was only 5.1%, which is excellent. We know that not all clinics report on no-shows, but based on the information we have, 5.1%, which in past years it's been closer to 10%, so 5% is excellent, showing that even though that there are patients that need to cancel, more of them are actually formally canceling than just not showing up for the appointment, which can waste resources. And then several clinics are cross-referring patients to WWC, CPED, or other programs such as charity care or some other local programs that provide additional services to your patients, and referring from those programs also to CCSP. And then if we can get the next slide to advance, there we go. Look a little deeper in some of the outcomes and the demographics of those patients screened. Similar to other years, we had about a 94% adequate prep rate, which is excellent. And almost all exams were complete. For those that we have the data on, 98% were complete exams. Looking at the reason for the colonoscopy, CCSP, as you all know, does reimburse for the navigation services for those patients that need screening, colonoscopy, or diagnostic for either symptoms or follow-up to positive FIT or FOPT, or surveillance if they've had a past colonoscopy with a abnormal finding. And so as you can see, the patients getting colonoscopies through CCSP, there's some great distribution between those three different types of colonoscopies. So just those screening colonoscopies is still the primary reason that patients are getting colonoscopy, but those diagnostic and surveillance are completely eligible as well, especially if your clinics are doing more FIT and stool-based testing with COVID. We are reaching the medically underserved, so 44% had Medicaid, 15% uninsured, which is slightly up from last year. And with the exemption for undocumented patients, that might have contributed to reaching some more of the medically underserved as well. Also, in terms of racial distribution, 43% of the patients screened were Hispanic, 7% African American, another 4% Asian or other racial groups, and then 46% white. CCSP continues to reach those within the USPSTF age guidelines for screening, with 67% between ages 50 and 65 and 18% older than, or 66 and older. But with increasing rates of early age onset colorectal cancer and maybe younger patients with a family history or exhibiting symptoms of colorectal cancer, we are reaching about 14% younger than age 50. And then we are so appreciative of you all diving into the pathology reports to pull the polyp type of the findings of your patients. And so we will provide some additional follow-up training next month about completing the report for CCSP. But so far, what we're seeing is about 46% of patients did not have any abnormal findings or polyps. And then about a quarter had benign polyps. So those truly benign polyps compared to 21% precancerous polyps, 4% advanced or high risk polyps, and 0.7% cancerous polyps. And so all of this data was the data that may have received some corrections based on the audit from this past year. So we know this is a big process to make sure that the data is correct, but in order to truly show the impact of the program, we want to make sure we have the most accurate data. But I'm very pleased to announce that we had an average score of 97% on the data audits this year, which is definitely a big improvement from last year, which was the low 90s, maybe high 80s. And thank you all for adjusting to the recent changes we had in the last 2 years of the data reports moving to Qualtrics. That new data validation tool, I think, helped eliminate some of the time that we had to spend correcting in the past just due to some typos. But there were a few recommendations that came up for continued quality improvement so that we can continue to see high scores like this and maybe even more 100% audit scores next year. We did have a few of those, so shout out to the 2 or 3 clinics that had 100% on the audit. Thank you so much for all of your work. So just a few recommendations that I wanted to point out to make sure that we continue to provide and collect quality data from each of you. So please try to use those tracking templates, whether it's the one CCSP provides or your own, throughout the entire year as you're collecting your patient data, organizing it for entry into Qualtrics. That way it can be easier to figure out if there's any discrepancies between the Qualtrics number and the billing number, where those may lie, and when we need to make corrections on the audit, easier to pinpoint where those mistakes would have happened, so that also when we're preparing for the data audit, you all don't have to scramble and spend a lot of time pulling the individual data and putting it into the templates at the last moment. Just a few points that I did see as the most common corrections that needed to be made. So the number reported in total patients navigated really should be your total number of patients that were successfully navigated into colonoscopy, those that were CCSP eligible and not CCSP eligible before you pull out the CCSP eligible number. So the total patients navigated does not include those patients that were a cancellation or a no-show. Those go in the next question on the report about appointment attendance, but the cancellations and no-shows are not included in the total patient navigated, because we really want to know how many patients, even those that weren't CCSP eligible, that were successfully navigated into their colonoscopy appointment. I'd also just remind you all that different providers use different language to indicate that the CECM was reached, that the exam was complete on the endoscopy report. And so they might use language including the cecum, or say the scope was advanced to the ileocecal valve or the terminal ileum. All of that means that the exam was complete and complete to the cecum, the end of the colon. And so before reporting as not reported, please just try to make sure you have a good understanding of how the different providers you work with provide that information. Also, again, I thought overall great job with the reporting on the different polyp type categorizations that are new this year. But I would recommend that all clinics review those different polyp types that fall within each of the categories, because polyp size and whether or not there's dysplasia present can affect how high risk or advanced the polyp is. For example, a hyperplastic polyp less than 1 centimeter is categorized within benign polyps, but hyperplastic polyps more than 1 centimeter are in that advanced or high risk polyp categorization. And just a reminder to, if possible, continue to report on the patients reached by your in-reach and outreach activities, the appointment cancellation and no-show rates, your cross referrals. And so if you've had any questions come up, maybe you're newer to the evaluation reporting or feel like you need a refresher on even the polyp type categories, we are going to host another CCSP evaluation reporting 101 webinar on Thursday, August 6th at 11 a.m. And so please encourage anyone who has any questions about the data reporting to please attend that session. It will be recorded if you're unable to attend live, but great review because of those recent changes within the last year. We will be maintaining the evaluation report the same into next year. So I'm going to stop here for a moment before I move on to the next area to see if anyone has any questions, comments about the CRC data for this year. I know I have been talking at you all for a few minutes. Alrighty, I got a few okays, so I'm gonna keep moving along. So we also did complete our fiscal year 2020 patient satisfaction survey this spring. So thank you to all of you who were involved in the process to pull the patients to receive the survey, get those envelopes sent out to the patient addresses. We did receive 49 surveys with some great statewide representation, and most respondents this year residing outside of the Denver metro area. And so a lot of patients from the Pueblo area, Northern Colorado area, and the Western Slope, but really some statewide representation for most of our clinics and all of our regions. And just a few snapshots from the results. So I'm happy to share the more complete summary of data with all of you, as well as if your particular clinic system is interested in the specific survey responses for your region. We did collect information by patient, city, and zip code, even though we weren't able to collect by specific clinic. But we did receive great feedback about all of the work in navigation you all are providing to your patients. 94% said they would recommend the patient navigation services they receive to their friends and family. There was great overall consensus that the navigators were very helpful in providing patient education prior to the colonoscopy about the reason for getting screened. also the education about the procedure itself and what's involved, and assisting them with scheduling their colonoscopy appointment. We do know that patients some of them did encounter some barriers to getting colonoscopy. The most common one is still those out-of-pocket costs and being able to afford the colonoscopy. Some of the comments on the survey were that you all went out of your way to try to find them some resources, and so all of them were ultimately able to get their colonoscopy, but the payment is still one of those common barriers that we're continuing to try to figure out the best ways to address. And there were some patients that were unsure of the findings of their colonoscopy, so they responded as don't know for whether or not a polyp was found, or if it was an adenomatous polyp, or even if there was a cancer found in their colonoscopy. So just wanted to highlight that to reiterate the importance of whoever is involved in that role, someone following up with the patient to make sure that they understood the findings of their colonoscopy, and a warm handoff to their provider if they were unsure. Overall, great feedback on the patient satisfaction survey, some wonderful comments that went to specific areas as well. And so if I know that the specific clinic they're talking about, I'm definitely going to share some of that patient feedback with you as all. But give yourselves a round of applause, or a silent round of applause for all of the hard work that you all are doing for your patients, and really making a difference in their experience with getting a colonoscopy, which might be something they're scared or unsure about. So overall, you're doing an excellent, excellent job with each of your patients, and they're very appreciative. And I did see a comment in the chat. So Jennifer from Stride shared that Colonoscopy Assist is a program that helps self-pay patients pay for colorectal cancer screening. Thanks, Jennifer, for sharing that resource. I can go ahead and send out a link to that in our follow-up notes as well. So with 10 more minutes left in our agenda, I just wanted to share a little bit of an update of where we're at with the sustainability planning, since most of our clinics have gone through that process now to complete the sustainability assessment and think about the priority areas to address and build a sustainability plan. So here on the right side of the slide are all of the domains of the sustainability assessment tool and framework that CCSP is using again. I just wanted to share what the top domains that CCSP clinics are selecting to focus their sustainability plans on. So if your clinic system has not yet engaged in this process, or if you did select one of these topics, knowing that there's a lot of clinics that are also focusing in these areas, and we are going to be trying to provide some opportunities this year for clinics that are working in similar areas to connect and brainstorm about their approaches. So workflow integration has been the most commonly selected domain. So clinics really thinking about improving their workflows for increased efficiencies, really making sure the role of navigator is very clearly defined in the workflow and how it connects to the rest of the clinic team. Maybe linking workflows for colorectal cancer screening to other services the patient navigators provide, or other screening types. Second most common was communication planning and implementation. So some of that might have been around internal communication, or different strategies for champion projects, to think about improving internal communication, or communication with patients, really making sure that your strategic plans line up with your sustainability plan, things like that. And then funding stability. So a few clinics are building business cases to really look at their data they have about patients served, the outcomes, as well as their financial data, and use that to build a business case to their internal team to integrate the navigator position within the budget to keep it going beyond CCSP funding. And then some clinics thinking about their evaluation, outcomes, and effectiveness, really looking at their data and how they can improve their evaluation practices. And so not as many clinics focusing on engaged staff and leadership, organizational context and capacity, engaged community. And that's really because those were the domains with the highest scores overall. The champions are really there for the work. Staff is engaged, sees the value. So even though there's some areas for improvement, there's a lot of strengths in each one of your clinic teams as well for patient navigation. So last year in our end of year call, we went through each of the goals of the first 5 clinics that were developing a sustainability plan. Each one of these clinics are continuing to implement their plan to reach their goal. I'm not going to read through all of these, but wanted to share if any of you want to look at this as well. And so then for our clinic systems this year, I've also put here just the goals for each clinic system. So those that really worked on going through the assessment and building a plan in FY20 was Brunner Caritas, Clinica Colorado, High Plains, Marillac, Peak Vista, Pueblo, River Valley, Southern Colorado Family Medicine, Sunrise, and Valleywide. So I just wanted to give each one of you a huge thank you for the time you took to complete the assessment, be thoughtful about what those strengths were and areas for improvement, and think about a goal that could be addressed in the remainder of CCSP funding. Again, I'm not going to read each one of these goals, but some clinic systems, for example, such as Sunrise, I'm just going to pull out one of these, is working on increasing their overall colorectal cancer screening rate and really increasing the rate of return on fit kits, working to integrate their care coordination team and MAs. They put together an updated workflow. We're working on some training and resources really to make sure, because FIT and stool-based testing is the primary screening modality they're using, that they're getting an increased rate of return with the continuing navigation support from CCSP for now for that follow-up colonoscopy. But with CCSP funding going away, there might be even more continued efforts on stool-based testing. So that's just an example of one clinic and what they're working on. So shout out to Irma and the Sunrise team. We're hoping to provide some more training, tailored technical assistance for each one of your clinic systems to the level that's helpful in the next year if you've already built your sustainability goal and plan. But if you haven't yet put together your sustainability goal and plan and gone through that assessment, some clinic systems have asked for ideas of different clinics' goals and what other clinics are working on. So feel free to look at these more in depth to get the wheels turning and think of some ideas of what might be the best fit of something to address in the next year. So with that said, we're now in our last year of CCSP funding, where we really can dedicate some of our resources, technical support and monetary support to really put each of you in the best place possible to continue to sustain the role of navigator for preventative cancer screening. once we transition away from the CCSP program as it is. So if you have not yet built your sustainability plan, we'll be reaching out to you within the next couple months by the end of the summer to look at your capacity to start that process. And if you have already built your sustainability plan, we'd like to continue to support you this year, checking in at least quarterly, and then having each clinic complete the assessment one more time to reassess capacity, what's changed, see if there's any adjustments that need to be made for the sustainability plan. And if you have any ideas of specific resources, topics for webinars around sustainability, or some opportunities for discussion to share resources and coordinate support, please let us know. And so the very last thing I have to end with today is just sharing some of our upcoming programming happening. So we will on July 27th be hosting a peer sharing conversation that Andy was talking about a little bit earlier, really thinking about how different clinics are continuing to screen patients for cancer screenings as the COVID-19 pandemic continues, and getting that work back up and underway while continuing to need to respond to COVID. And that's really just going to be a conversation based with one or two clinics briefly sharing about what they're doing, and then a lot of interaction and discussion. So I will have that link to share in the follow-up notes. I just received it. And then next month, our monthly call is really going to do a deeper dive into the current state of CCSP and thinking into next year and continuing that sustainability talk and thinking about CCSP beyond this grant year and where we're at. And so both our partners and clinics will be invited to that one as well, might be a larger audience. And then finally, on Thursday, July 6th at 11 a.m. is when we're going to host that CCSP evaluation reporting tutorial. And so based on who's in attendance, I can just go through the whole report step by step, and then also have some time to respond to your specific questions and do any troubleshooting. So with that, that's all I had for today. We're right at 1 o'clock. I am going to, now that I'm able to stop sharing my screen and have access to my desktop real quickly, I'm going to put that link to the survey in the chat. So clinics, if you, each one of you could have at least one person complete the survey of our what you're thinking about for the end of this year and moving on into next year, we would greatly appreciate that. So if you need to sign off right now, go right ahead, trying to pull that link really quick. It did fade away a little bit. So thank you so much for taking the time to join us today. We really appreciate it. And I now have that link, so going to copy and paste it. Sorry for the delay on that. And thank you so much for joining us today. We really, really appreciate it.